Transient osteoporosis of the hip tends to affect middle-aged men from 40 to 55 years old with male to female ratio of 3 to 1. When women affected, it is usually during the third trimester of pregnancy. Generally, only one hip is affected at a time. Recurrence in the same hip is possible. Clinical presentation. Typically, patients present with spontaneous onset of hip pain, usually progressive over several weeks. In some instances, patients can go on to develop similar changes in the opposite hip or in other joints. Such cases should be referred to as regional migratory osteoporosis. Radiographic features. MRI is the modality of choice for the detection of transient osteoporosis of the hip and demonstrate bone marrow edema pattern involving the femoral head, neck, and even intertrochanteric region without findings of osteonecrosis. Subchondral fracture lines can be found in almost half of cases. Sparing of the medial femoral head by bone marrow edema can be found in almost 90% of patients and disappears toward the later stages of the disease. Signal characteristics. On T1 MRI coronal image, it revealed decreased signal with loss of normal fatty marrow signal, image 2. While it is worth having a coronal of both hips so that one can compare the distribution of fatty marrow signal. On T2 MRI coronal image, high signal, often heterogeneous, may be striking. Regarding the nuclear medicine, typically, bone scintigraphy demonstrates markedly increased homogeneous uptake in the femoral head, a finding which is seen well before osteopenia is seen on plain films. Bone scintigraphy is not the modality of choice for evaluation of this patient. Image 3. After healing of the bone marrow edema, we have two possibilities. The first one is complete healing of the disease, or a line appears in the femoral head giving possibility of one of the following. If the line is parallel to the femoral cortex, give diagnosis of subchondral fracture, figure 8. But if it shows mirror image with femoral cortex, give diagnosis of avascular necrosis. To differentiate, do bone scan. If gives photopenic area, it will be avascular necrosis, and if it gives hot area, it will be subchondral fracture. Differential diagnosis between avascular necrosis, subchondral fracture, and red bone marrow. In case of avascular necrosis, which could be unilateral or bilateral, figure 9, on T1 it shows geographic line forming mirror image with cortical margin. While in case of subchondral fracture, usually unilateral, figure 10, on T1 it will shows a parallel line with cortical margin. In case of red bone marrow, which is usually bilateral, image 11 and 12, it will shows hypointensity on both T1 and T2 images.